Hey guys, so today I figured I would make a video to talk to you guys about some things to remember when caring for patients or residents. And of course, I have my handy dandy notebook, so you guys know if I'm looking down, it's because I made notes to keep myself on track throughout this video. So, the number one tip that I can give you guys is these people are depending on you, you know, for whatever reason. They're in the facility that you work in, or you're going to their home if you do home health, and because of that, they're depending on you to provide the care that they need and the assistance that they need. Even if it's someone who is a quote unquote difficult patient or resident, you still have to be there and help them out because they are depending on you. And to go along with that is make sure that while you're on the clock, you're doing what you're supposed to be doing. You're doing what you're there to do. You're doing, your job. Make sure that you're not just slacking off and, being on your phone, not paying attention, not answering call lights, just basically goofing off while you're getting paid for taking care of these people, but you're not actually taking care of them. I've experienced this firsthand with multiple CNAs throughout the last 2 years that I've worked as a CNA in the different facilities that I've worked at. So just make sure that you are basically giving them their money's worth, because especially if you're working in a facility, these facilities are not cheap. They are very expensive, and so these people deserve to be getting their money's worth from you. Number 3, if you're working night shift, stay awake. This should be so simple. Like, if you were working day shift, you wouldn't be sleeping during day shift, so why would you be sleeping during night shift and think that that's okay? I understand that sometimes night shift is a little slower than day shift, so it's easy to get tired and zone out. And, especially if you turn the lights down on the unit you work on, like most units do on the night shift, it can be like an introduction to sleep, because you have the lights turned down. So it's like, ooh, nighttime, time to go to bed. No, if you're working night shift, you're there to work. So stay awake just like you would if you were working day shift or evening shift. Number 4, remember that the residents have a choice. If they tell you no, you cannot force somebody to do something. It's illegal. They have rights. They can decline medication. They can decline your care. They can say that they don't want to do something. And, if they don't want to do it, you can't force them to do that. Obviously, if it's something that is affecting their personal safety, then that's a little bit of a tricky subject and situation, because you have to make sure that they're safe. But, if they don't want you to change their clothes, don't change their clothes. When I have people who reject my care, I will chart it, first of all, and then I will try to reapproach them. If they still say no, I'll chart it again. I try basically 3 times, and then if I still get a rejection on the 3rd try, then that's when I'll say, hey, so-and-so doesn't want this done, so I'm going to chart that they don't want it done, and I'm not going to keep trying to force the issue. Because sometimes constantly going back and asking them to do the same thing when they've said no a bunch of times gets annoying, and they're going to get angry with you. Number 5, if you're having a bad day or you're dealing with personal problems, don't bring them into the workplace. Don't let them affect the work that you are doing. Don't let them affect the care that you're providing to your patients or residents, because, when you walk through the door of their room, these people need you, and they need you to be at your best. And so if you can't provide your best level of care, don't even come to work. I mean, it kind of sucks to say that, but you need to be at your best when you're at work. And if you're not able to provide the care and the services and assistance that these patients and residents need, then it's not fair to them to have a CNA who could care less about taking care of their needs and helping them with whatever assistance they need during your shift just because you're having a bad day. You know, some facilities are really good about, you know, if you need a personal day because you're overwhelmed or something like that, they're good about that. Other facilities really could care less. I've experienced both. But just try to leave your personal problems and your drama and all that at the door. Don't bring it into work with you. Kind of going along with that is respecting their attitudes and emotions. You know, just like you can have a bad day, they can have a bad day as well. And it isn't fair for you to get upset at them because they're having a bad day or because they're angry or upset or emotional or sad, you know. A lot of people, when they move into facilities, their family doesn't come to visit them. You know, they don't really have any visitors, and you're sometimes the only person who comes to see someone, and it's sad. But, you know, that's somewhat of the reason why people tend to get emotional and upset when they're in facilities, especially long-term care facilities. So just keep that in mind. Do not ignore any residents or patients. I've seen this happen as well, where somebody will be talking to someone as they're walking past in the hallway, and that person will just continue walking as if they never heard anybody say anything, and that's not right either. If you really didn't hear someone, then obviously that's a different story, but if you're just walking past because you don't want to deal with whatever it is that they are asking you to do, that's not fair and it's not right. Number 8, remember that this could be you or your loved one. It is so easy to become disabled. Accidents happen, things happen all the time. You know, I've met really young people who have become disabled by no fault of their own, just from, you know, getting sick, getting the flu, you know, and then they end up not being able to walk, or they get some type of infection where they have to have an amputation or something like that, and it's things can change like that. And so it could very easily be you or your family member without anything, you know. I've had patients before who, you know, got injured in a car accident, got injured in a bike accident, and then they're suddenly totally dependent on someone because they had a brain injury or something like that. And so it's hard to think about, but it could very easily be you or your family member. Like I said, accidents happen every day. And my last tip or thing to remember is you are in their home. Whether you're providing home health or you are providing care in a nursing home, you are in that patient or resident's home. It is a little bit different in the hospital because you're not in their home, but if you're in the nursing home or home health setting, you are in their home. You know, they're not in your workplace. You work in their home. And I know that sounds really cliche, but it is very true. Respect their space. Respect their space as if it was their home, because it is. You know, you wouldn't want somebody coming in and moving everything around without your permission in your own house. So why would you do it in someone else's? You know, just make sure that you're being respectful of their space and their belongings and them as well, you know. But those are just my tips. I felt like some of them are pretty common sense, but others people might not think about right away. So I thought I would talk about it. Hopefully you guys have found this video interesting and or helpful, hopefully both. So yeah, if there's anything you guys would like me to address in a future video, let me know and I will be sure to get it filmed for you. And with that being said, I will talk to you guys again in my next video.